Hey guys, how you doing? This is D Durrell with D Durrell Life Solutions. Today, I am broadcasting here from my vehicle. Today, I decided to just to provide a quick video to kind of talk about biasness or the lack of biasness, which is more or less of what may be presented in a counseling relationship, in a therapy session. So the reason why I'm talking about biasness and I'm talking about transference and countertransference is because there has, over the last year, have been two black female, like I would say TikTok black female therapists, I was just going to say female therapists, who talked about their frustrations with counseling black males, black men per se. The most recent is a lady who talked about her frustrations with providing therapy sessions for black men, and black men all in her DMs, and they're vetting her and asking a lot of questions, and that was irking her, and she felt like it was very toxic to her, and she felt like she didn't have to deal with all of the stuff that occurs when black men are wanting therapy from her. And I want you all to keep in mind that I do think in her position, her best choice was to not provide therapy for these guys because of her biasness and because of maybe her lack of skill, that's not necessarily talked about. And the fact of the matter is that when we are being trained as therapists, we're not only being trained to counsel women, we're also counseled to provide therapy for men, kids. It doesn't matter. We're trained in all aspects of human life, regardless of sexuality, regardless of, your social economical background and culture. Your training prepares you for every scenario that would be presented in the therapeutic environment. And so it was very unprofessional. I won't say unethical. But it was very unprofessional to do how she presented herself. It was very unprofessional in how negative she talked about potential clients. It was very unprofessional how she presented the mental health field. As a therapist, we're in an industry. I want y'all to understand, we are in an industry that people are not happy to get services in. Like, people don't come to therapy happy that they're in therapy. People do not come and seek therapy services because everything is going great in their life. And there's a lot of fallacies and a lot of falsehoods as it relates to mental health, which discourages people from wanting to seek those services. And people just flat out don't want to feel like they're inadequate and don't want to feel like they're mentally ill or the quote-unquote term crazy. So what she presented was the fact of contributing to what is wrong with the mental health side, not necessarily from the consumer standpoint, but from the professional, from the delivery of services, from the professional standpoint as a clinician. What she should be embarrassed. And for anyone that's in the field that's a friend of her, they should let her know she should be embarrassed for what she did. And there are tons of people that don't understand the training and all aspects of mental health that think she did a great job of speaking for women and saying you don't have to deal with this. And she used her own life experiences to mix in, the reasons why you came to that conclusion. And the reality is this, because I'm speaking about biasness. And as a therapist, we are trained not to be biased. Not to say that we won't show some level of biasness, although it is highly, I would say negative. It could have negative outcomes to a therapy session or your client by you showing biasness. Biasness does nothing to heal the client. Biasness does nothing to improve the behavior or whatever goals they're trying to deal with. Those are your own internal issues that you need to deal with. That's not the client's problem. It is nothing wrong with a male or female. If you are an LCSW, and I don't know why she has an LCIW, I don't know what that means. If you're an LCSW, you're no longer an intern. I don't know the purpose of putting your intern license and your professional license up there. I don't get that. But the fact of the matter, if you are advertising yourself as a professional therapist, this is what people do all the time. I just want y'all to understand this. This is what people do all the time. When people see my website or they know that I'm a therapist, they ask questions, they vet me. Now, I get you don't want to have 20, 30, 40-minute phone calls for free, people trying to get free therapy. I get that aspect of it. But women do this too, you know. Women also. Matter of fact, women are more prone to vet you and want to ask a bunch of questions than men are. So I don't know what this whole thing. Women have a tendency, because women participate in therapy more than men, and particularly black men. We're at the bottom of the list. So I find it highly unusual for the group of people who are the least likely to seek therapy or asking the most questions about wanting to go into therapy, as if they're emotionally and mentally vested in carrying it out. And then some may say, well, maybe because they the least likely is because they're more skeptical about it. That's why they're asking questions. No. When men make up their mind about doing something, they may ask a few questions, but they do it. They don't go about trying to find out your whole life and all your credentials, which, by the way, as a consumer, you have the right to do so. Now, you as a professional can say, okay, I can take this phone call and I can limit it to 5 minutes, 8 minutes, 10, whatever you want. For me personally, I'm not going to be on the phone with a client more than 5 minutes. Maybe 10 minutes, depending on if it's a crisis situation. Then it may have to, extend. But as a consumer, and I want to say this to anybody, male or female, you have the right to vet a therapist. You have a right to ask all the questions. And all she had to say was, why don't you book a 30-minute consultation to see if we're a good fit, and we'll go from there. Now, I don't understand this good fit. I don't know if that was the best way to use that. I would say, based on you giving me the information, I'll determine whether or not my skill level is appropriate to treating you. But if you want to say good fit, whatever you want to use. So, biasness should not exist in a therapeutic relationship. Although mistakes can happen from time to time, and if it does happen, a professional therapist should be able to resolve that quickly. Okay, I like to revert back to skill level and experience. Now, this lady may have had a bad day, just like the other TikTok therapist. Sound like she had a horrible, bad time, things going on in her life, so she felt the need to go on TikTok. I'm encouraged therapists. If you're having a bad day, don't talk about the field. Don't talk about you as a therapist. If you are frustrated, don't relate this to you and your clientele. Now, I don't know if she's in private practice. I don't know if she's working for a company or not. But it was just a bad look, not only for black female therapists, but for also therapists, period, particularly black male therapists. There's not many of us in the first place. So, biasness should not exist. Not to say it will not exist at times. If it does exist, it should be identified immediately by the therapist, and it should be eradicated. So this is D. Darrell Spears, your black YouTube therapist. Have a great day.